Dandruff is a common scalp disorder affecting almost half of the population at the prepubertal age and of any gender and ethnicity. No population in any geographical region would have passed through freely without being affected by dandruff at some stage in their life. Hello friends, welcome to our channel. In this video, we will discuss about scalp health, dandruff, seborrheic dermatitis, and its cure. Despite an increasing knowledge of dandruff and seborrheic dermatitis, the pathophysiological understanding is still incomplete and only suggests a role of Malassezia fungi, yeasts in triggering inflammatory and hyperproliferative epidermal responses, but in reality, it's not true. There are several other factors which intervenes to this problem too. First, we need to know structural and biomolecular abnormalities associated with dandruff, seborrheic dermatitis. There are 4 sequential pathophysiological phases that causes dandruff: fungi, Malassezia ecosystem and interaction with the skin, initiation and propagation of inflammation on the scalp, disruption of proliferation and differentiation processes of the scalp with the environmental condition. Malassezia are commensal scalp fungi that are generally regarded as an etiological factor in seborrheic dermatitis. A potential etiopathological mechanism involves where Malassezia fungi's enzyme breaks the oils, sebum, produced by sebaceous glands into free fatty acids. These free fatty acids, especially unsaturated ones, can induce the inflammation and hyperproliferation. This is the initiation of second stage of pathophysiological phases, which may include irritation and inflammation of scalp starts. Another reason behind inflammation and irritation is dry scalp condition, where the person is born with skin that produce less or no oil from sebaceous glands. There is a big difference in dry scalp and dandruff condition. In dandruff, big yellowish flakes are formed on the top of the epidermis, but in dry scalp condition, small white flakes are formed. Both the conditions cause inflammation, which then triggers new dermal layer to replace the older layer in a faster rate. And the older layer sheds in form of small yellow or white flakes. Inflammation irritates the scalp, increasing an urge to scratch, followed by redness. An important point is, longer period of inflammation affects your hair health, but in same case, micro-needling in the scalp having a short inflammatory period could trigger hair growth. Environment plays a very important role in seborrheic dermatitis, with people of different skin type, normal, dry, oily, combination, both oily and dry skin. In case of dry skin type, the sebaceous glands face difficulties in increasing the sebum production in cold seasons for more efficient moisturization, thereby producing white flakes or dead tissue. In case of oily skin type, oversecretion of sebum increases the fungal activities on the scalp, causing seborrheic dermatitis, dandruff. The cure of this condition depends upon 3 factors: the scalp type, environmental condition of that particular place where a person stays, any severe medical conditions. According to scalp type, dry scalp people should involve in oiling the scalp 2 to 3 times a week. Because this type of condition generally not related to dandruff, the frequency of oiling should reduce in case of oily scalp, which is not more than 1 to 2 times a week. In this case, washing the scalp with organic shampoo after 1 hour is recommended, so that there will be no chance of fungal growth. Irrespective of skin type and scalp condition, oiling is very much essential for moisturization. Adding herbs extract which are clinically proven like bringraj, false daisy, hibiscus, indigo to the oil enhances the curing effect. Those who are staying in cold climate should use virgin castor or mustard oil as a base oil, and people staying in warm climate should apply virgin coconut oil as a base oil to get best result. Regular cleaning the scalp develops unfavorable environment for any fungal or microbial growth. Organic shampoo, which are made up of herbs like amla, Retha, shiitake helps to reduce this condition. Tar is widely used in the treatment of psoriasis and found to be very effective in dandruff as well. The staining properties, odor and mess in using tar limit its choice. Tar preparation work through anti-proliferative and cytostatic effects. Although definitive analysis is difficult because of the large number of biologically active components in coal tar, tar products disperse scales, which may reduce malassezia colonization. In the mouse model, it was found that topical application of tar suppresses epidermal DNA synthesis, which resulted less flake formation. Sulfur is an FDA-approved ingredient used in common over-the-counter products to treat dandruff. However, available research on its effectiveness is limited. Some research shows that using a shampoo containing sulfur and/or salicylic acid twice daily for 5 weeks reduces dandruff. So, this all for today's video. In next video we will talk about another topic. If you like this video, please do subscribe and press the bell icon to get the latest videos in future. Thank you.